This is the 11th in the series of short presentations that discuss some of the current myths in risk management. The primary purpose for managing risk is to improve decision making so that it makes it much more likely that our subsequent actions will contribute as much as possible to the achievement of our goals and objectives. It has no other purpose. However, unfortunately, some in the risk management profession seem determined to make what are quite simple and useful concepts and processes much more complex and opaque. This set of presentations therefore seeks to demonstrate how confused and confusing is the way many in the profession explain how we should manage risk. This myth concerns the process for risk assessment and risk treatment, how we identify, discover and understand risk, and then how we decide how to respond to it. And classically, organisations roll the whole thing together in one glorious workshop. Somehow they try and identify the risks, they try and analyse them, and at the same time think of solutions. And when time is precious, invariably something gets squeezed. It can be that we spend too much time talking about solutions without defining the risks or analysing them properly. Often it means that the risk treatment discussions are skimped and almost throwaway lines. There is, of course, the temptation that we can start thinking about the solution before we define the problem. And it wouldn't be the first time that people have all decided what they want to do and then try and backfit the risks and the controls and so on to suit what they're already intending to do. So let's try and understand this activity called risk treatment. Despite what many people think, sitting down and identifying and understanding risks actually doesn't create much value. And in fact, it takes quite a bit of time and quite a bit of energy. And because of that, people think that the risk register that comes out of that process actually has value. And really it doesn't. It's just a snapshot, a record, if you like, of the discussions that took place. It is only when we decide what we're going to do, because the levels of risk are unacceptable, that we actually create value. We create value by deciding the actions we intend to take to further modify the risk, effectively to change or create new controls. And because that is the point at which the goodness comes out, that is the point at where we create the great value, we really don't want to rush this. We don't want to tack it on to the rest of the discussions when people are feeling already tired and worn out. You know, risk identification, understanding and discovering risks normally is carried on through some form of structured brainstorming. There are a variety of methods for this, but invariably they involve some momentum. They involve people thinking constructively, one after the other, to come up with a list of things that could happen that could then lead to consequences for our objectives. And of course, stopping that discussion after every risk so we can then carefully tease out the ways we might want to treat the risk destroys that momentum. Also, this risk identification is a right brain activity. You know, we need to be intuitive, thoughtful, subjective. We need to think imaginatively about risks and what could happen, what it could lead to. And we need to do that in a fairly unchallenged way. On the other hand, risk treatment is definitely left brain activity. It has to be careful, systematic, logical, analytical, and fairly objective. Risk treatment really requires us to think of the alternatives and options of risk treatment and then carefully examine each in terms of the benefits versus the disadvantages and costs before we reach a decision on the preferred actions to take. It could be we end up with, for example, 10 potential forms of risk treatment, and only 6 of them will go forward because the benefits exceed the costs. Of course, if we find a risk treatment activity where the benefits do exceed the costs, then it's value accretive. We are creating value, that it will have to go forward at some point in the future. But of course, to do this, to systematically come up with a range of alternatives and then evaluate them all in terms of benefits, costs, tease them out into separate actions, well, that takes time. And you have to say, do we really have time for this for each of the risks we've identified? And moreover, do we actually need everybody present, all the people that are there to identify and understand the risks? Do we really want them there when we're getting into solution mode? In fact, do we need other people there, maybe some specialists, to give us some technical advice on how practically we might achieve some of these treatment actions which lead to new or improved controls? The best practice method is clearly not to consider risk treatment at the same time as you're identifying and analysing risks. In other words, not to try and rush everything in the same meeting or workshop. Of course, invariably people will throw up suggestions during the risk assessment, and it's good practice just to record those, maybe in a final column in the risk register. But look, they were just suggestions, off-the-cuff suggestions. They weren't created systematically. The most cost-effective and beneficial way of doing risk treatment that creates the greatest value is to hold separate short meetings with risk owners and any specialists or other people they might want to be involved for each of the risks they own after the risk identification analysis workshop. These meetings can typically take 30, maybe 20 minutes, and during them we can use the template, for example, such as that on the screen. Simply to think of all the options, think of the benefits, think of the disadvantages, and then draw a simple conclusion. Yes, because it's quite clear the benefits exceed the disadvantages. No, because the disadvantages exceed the benefit. And maybe where we're not quite clear and somebody has to go away and worry it a bit more and look at it maybe from a fully quantitative cost-benefit analysis. It's also a good time to decide who is the owner for that action. Maybe not the person who actually has to do it, but who is accountable for making sure it's done, and when will it be completed by. And of course it makes a lot of sense if the person who is the owner of the action is present in the room and can commit to that completion date. So you see, we now have a fairly systematic and thorough way of developing actions to treat the risks, and this is done outside the workshop or other form of discussion where we identify and analyse the risks. It's certainly the most cost-effective and appropriate way to create value from the risk treatment activity. Thank you.